Hello and welcome to the EuroHealth podcast. My name is Jiří Svoboda and this is episode 2 of the season 3. And joining us today is Philippe Roux, Acting Director for Public Health, Cancer and Health Security at the European Commission's Directorate-General for Health and Food Safety. Mr. Roux, welcome and thank you very much for your time.
Thank you. I can say that I'm also at the same time as Acting Director, I'm the head of unit responsible for cancer and health in all policies.
And that will be precisely one of our topics today, precisely the EU's plan on beating cancer. But before we dive into that, let's start a bit more broadly. You've been around in the Commission's main body for healthcare for almost 20 years now. So especially the last 5 years due to the pandemic were very turbulent and hectic. Would you be able to sum up the main achievements of the European healthcare in the last 5 years?
Well, that seems to be a bit challenging. What I would say is that we have what we achieve is indeed to survive and help the European Union survive the COVID, and I think that is already per se an achievement. And we are now putting in place all the tools to ensure that we are better prepared for the next crisis with the European Health Union. So we have put new tools in place. We have reinforced the existing tools, such as the European agencies. And we created ERA as a new Directorate-General. So I think we have done a lot on that part. And at the same time, with the dedication of colleagues, we have continued to work on the different files that SANTE was responsible for before, and in particular in this directorate, for instance, a part of this mission letter, we had the cancer plan, so which actually we did develop well.
Would you say the collaboration between the different agencies and bodies of the European Commission strengthened during the pandemic and after it?
What I would say is, they were already good. What actually is now improved is the different roles that each of us have, and I think that has been a tremendous progress.
Mm-hmm. So one of the key topics or one of the achievements in the past years of the DG SANTE was introducing the Beating Cancer Plan, which was introduced in 2021. You are basically one of its architects. So to start it off, why was a common pan-European response to cancer needed at the first place?
Well, I think, to make a long story short, you're perhaps too young to remember, but we started to work on cancer. It was one of the first issues that we dealt with at European level, and that it is certainly an area of work which is indeed on the watch of the Commission since very long. Also important to say is that we made a lot of progress. In the sense we are living longer, but linked to that, we have unfortunately also much more chronic disease, and cancer is one of the most problematic one, making it indeed an interesting priority for us.
Mm-hmm, mm-hmm. Would you say, of course, the plan on beating cancer is very wide and there is a lot of different initiatives and programs to it. Would you say there is like one common goal, perhaps measurable one, that you're trying to achieve with that beating cancer plan?
Well, indeed, we have tried to cover the entire path, I would say, and therefore we have more than 10 flagships and 30 additional action strands. So it's really an ambitious project, I think. And the goal is indeed assuring that we all benefit in the EU of the best possible treatment and the best preventative measures and the best support after the disease. So these are three goals, I think, which are very important to me. And I think all actions are pointing at ensuring that we successfully reach a situation where we can be ready to better defend ourselves against cancer.
So, of course, cancer as a disease is one that affects large parts of the population, but its likelihood can be reduced by living healthier. So, one important topic for the plan for beating cancer is health literacy. So, I was wondering, how does the plan really favor the health literacy within the population?
So, as you said, health literacy is a crucial aspect of cancer prevention, and indeed one of the key pillars of our Europe's Beating Cancer plan. And we have been working to enhance health literacy across the member states through various initiatives. We have first probably something that you may know already, which is the Code Against Cancer itself. It was first established by the Commission in 1987, so the first version dates now, and it has been since then updated with the latest scientific evidence, with the best practice on prevention for cancer, and the current fourth edition of the code outlines 12 key recommendations that individuals can follow to reduce risks to develop cancer. So that is one of these tools, and these recommendations cover a broad range of lifestyle factors and behaviors that are known to influence cancer risk, and they include avoiding tobacco in all its forms, maintain a healthy weight, being physically active, eating healthy diet rich in fruits and vegetables, limiting alcohol consumption, protecting oneself from the sun and avoiding exposure to carcinogen in the workplace, and participating in cancer screening programs. So that's a very important tool for us. And we are even now updating with the latest scientific evidence the code, and we will review it and have a new version next year, so the 5th edition. And we also have developed an EU mobile app for cancer prevention, an innovative tool which is being developed as part of the EU-funded Bumper project. And this project aims to promote awareness of the cancer code and facilitate its adoption by individuals in their daily life. So really a tool that's simplify with very practical tips, resources, and reminders to help users to make healthier choices and reduce their risk of cancer.
Mm-hmm. Mm-hmm. So, how did the Commission approach the preventable causes for cancer at large? So, is it rather approaches that try to eliminate the cause of cancer, for instance, banning certain substances or products, or rather encourage healthier choices in life? Is there a particular path you try to take between those two?
I think it's a mixed in the sense, of course. Healthier lifestyles are key to limit the risks, but also we have to support and facilitate healthier choices, and so that's the reason why we have worked indeed also in trying to help the citizens to make healthier choices in the way they choose food. And also to protect them from tobacco consumption and to help limiting tobacco use, for instance, in particular among young people.
Tobacco is, of course, one of the big topics in this regard. The plan includes the goal of achieving a tobacco-free Europe. That seems like a very ambitious goal, considering that about 18% of Europeans over 15 still today smoke daily. Is there a particular way how do you wish to achieve this goal?
Well, the way to achieve this goal is to cooperate with the member states in order to create the environment that on the one hand, makes it more difficult to use tobacco and to protect people from the use of tobacco by others. So that's, for instance, all the rules that have been put in place to forbid smoking in public environments, and the enlargement of these public environments, and our work at international level in the FCTC, which indeed where the Union has a relatively strong position to protect citizens and young people from tobacco use. So cooperation with the member states, for me, would be the main element to mention here.
There is also a new joint press release from several NGOs from 31st of May of this year that pressed or is trying to press DG SANTE on acceleration of policy action to help towards a tobacco-free generation. They have expressed, quote, a disappointment at delays and stalled activity on previous pledges. Of course, this is a very new quote or a new stuff which I'm reading right now, but would you have any comment on that stalled activity, as these NGOs say?
Well, my way of answering to that would be reasonably simple. You can see the bottle half full or the bottle half empty. It is true that we have mentioned COVID before, and so that made it difficult to progress at the speed we initially wanted on some of the files. But we made already a lot of progress in many parts of the plan. And if we are late on some of these, doesn't mean that we have not gave up with the objective. So, which means that we are still working to achieve. So, and work doesn't stop now. But again, when I say see the bottle half full, I mean, we have done a number of things which I would be happy to share with you. I mean, we have set up, for instance, in 2021, the Knowledge Center on Cancer, which is for me a flagship initiative for research and innovation. And it helps mapping the latest evidence on cancer and provide healthcare guidance and quality assurance scheme across the EU. So that it is one concrete example. It also helps the development of a data tool that we have put at the disposal of the member states, which is the European Cancer Inequality Registry, for instance, which indeed helps to better understand cancer inequalities between and within the member states. And that with a view to inform investment decision at EU and national level. So that, for instance, is another development that we have rapidly put into motion. You mentioned elements of prevention. I think we have been already achieving on the update and expansion of the Council recommendation on cancer screening in 2022. So another good example for me of all the efforts that have been successful so far. And we are recently working on a proposal that we made for a council recommendation on vaccine preventable cancer, for instance, which aims to boost HPV and hepatitis B vaccination across the EU with the long-term goal of eradication of cervical cancer. So that's also another, for me, key achievement. And perhaps another one, which is for me not small, which is the networking of cancer comprehensive centers and the development, for instance, of trainings, interspecialty trainings in particular, to improve integrated cancer care, which are important for patients. And we have now more than 100 cancer centers across the EU that are implementing these courses. So that's another type of progress. So you see, we have in different parts made a lot of progresses.
Mm-hmm. There is also going to be a new legislation for tobacco regulation, perhaps in the next European Parliament. But this consultation of this legislation received 24,000 responses, mainly from EU citizens. And this is estimate according to the media. But is it common for a consultation on a new legislation gather so many responses? How did that come to be?
Well, that it is indeed. Not all public consultations leads to so many response or questions or contributions. But I would say that a number of them do, and it is part of the democratic system that we have in place, which is, I think, reasonably healthy. So, indeed, we know that there are pressures in fights like the tobacco one, but I mean that's for me absolutely normal, and we are progressing well in the preparatory work here. So I'm very confident that we'll be able to have the best possible result.
Let's go a bit into the role of other EU institutions in your agenda or in your field. The European Parliament also took an interest in the topic and published its own report with the aim to identify measures to help prevent and fight cancer. How was the initiative met in the Commission? How did you like or dislike the ideas that Parliament proposed?
Well, I think we have not. Well, first of all, let me start by saying that Parliament has always been an ally for public health and health issues. From my own perspective, I don't see much tension or difficulties with what the Parliament is proposing and is willing to see developed. I mean, this is we are mostly, I think, in line with what is proposed there. So for me, I don't see a difficulty here. On the contrary, I mean, as I said, I mean, we have worked with the Parliament, and the Council plan was indeed adopted 1 year before the Parliament's resolution on strengthening Europe in the fight against cancer. So we had done it before. We started before, so to say. So and the plan itself outlines self-commitment on actions that the Commission can take under its own competence, and that's also very important to mention because, of course, a number of activities do not rely in the hands of the Commission. I mean, and that's important to mention. If you read the resolution of the Parliament, they welcome and support the Council plan. And it's not surprising to me that in some of the areas, the Parliament puts a slightly different emphasis on some actions. But as I said, we have analyzed the resolution, and when it's feasible, the Commission is taken the recommendations of the Parliament, and as long as it is under our own competence, I mean, we are very happy to develop and to push forward. And I don't see really a big divergence or a divergence between the Council plan and the Parliament resolution.
Mm-hmm. Mm-hmm. For example, in the field of cancer prevention, Parliament seems to propose stricter measures on alcohol consumption compared to the Commission. Did you feel any differences, pressure there, or was that also a normal part of discussion?
I think there is a line which is indeed very clear, and that comes from the WHO. So the WHO position vis-à-vis alcohol is the one that the health authorities have to consider. And in this context, the Commission doesn't play a central role, I would say. It's more for the member states indeed to consider how to best approach it, and the Commission in there is willing and happy to help.
Mm-hmm. But the member states also, all of them have their own experiences and their approaches. National interests, of course, play a role here as well. And some of the best practices are sometimes at odds with each other. On tobacco, for instance, member states are divided on the restrictive and preventive approaches. How do you want to harmonize this kind of differences?
Well, here, we don't harmonize differences. I think that's differences are to be differences, and when we talk of harmonization and we talk of legislation, of course, this is through the democratic process that is in place in the EU. So, for me, we consider that it's important to work hand in hand with the member states and with the parliament, and to see and to go always as far as it is possible to approximate the approach by the different member states and discussions. And for us, I think I've mentioned before the fact that we had created a number of tools to help the decision making by the member states, and I think that's where I want to come back. And for instance, the Knowledge Center on Cancer, led by our colleagues in the GRC, is one of these tools that help a future, I would say, in terms of decision making in this field.
Okay, so the Europe's Beating Cancer Plan is, of course, still ongoing. As you said, there are already many achievements and a lot of things are in progress currently. But if you were to choose one crucial thing, one crucial aspect that you hope to still implement within the plan, what would it be?
Well, there are a number of things. Let's first of all consolidate what we have started. And there is one which is important to me, I think, is the development of cancer comprehensive centers and their networking, because that's for me an important tool, in the sense it is a mean to ensure that the best treatment can be offered to our citizens, or the best advice, and that knowledge can circulate and people be better treated because of better diagnostics. So this is very important to me. And in this context also to ensure that we have also solutions adapted to the needs and the situation of the small member states. So if small in size, meaning where it's not so easy to have a comprehensive cancer center in the same way than in the large countries. So this is certainly one area in which I would want to see more in the future to ensure that we are indeed achieved.
Mm-hmm. And finally, in the beginning, I asked, what would you say are the biggest achievements in the last 5 years in the European healthcare? Let's close this on more envisioning the future. Where do you hope the European healthcare be in the next 5 years from now?
That's a question I cannot answer, for the simple reason that this is a question that the Commission will have to consider, the new Commission will have to consider.
All right. That was Philippe Roux, Acting Director for Public Health, Cancer and Health Security at the European Commission's DG SANTE, or Directorate-General for Health and Food Safety. Mr. Roux, thank you very much for your time.
Thank you.
And this was the EuroHealth podcast. Thank you very much for watching, and follow us for more.